We're back. This is the Alaska Academy for Drug Abuse Prevention, located deep in the heart of the Tongass National Forest, coming to you from Tenakee Springs, Alaska. This is our podcast, A Voice from the Wilderness, and with me today is my host, J.T. Collins, and we're interviewing Kathy Munoz, who's the acting commissioner of the Labor Department for the state of Alaska. Welcome, Kathy.
Hello, Tuck. Nice to see you.
Yeah, it's great to see you. Kathy's a good friend of ours, and she's actually a member of our community, so it's nice to have somebody with us that we know. And it's great that you've been able to participate in our show today, Kathy. So first thing we want to talk about is the fact that you are the person who really pushed legislation in the state of Alaska, bringing Narcan to the general public. And we'd like you to explain a little bit about how that process came about and how you got that. And this is while you were a state legislator, how you got that pushed through the legislature at that time.
Okay, thank you, Tuck. Well, first of all, there's never one person that can be responsible for a piece of legislation that passes the legislative body. And in this case, it was Senate Bill 23. The prime sponsor was Senator Johnny Ellis in the Senate, and I was the prime sponsor in the House. But in all, there were 39 legislators that signed on to this piece of legislation. So it was definitely a group effort. And it came at a time when there was a real spike in drug overdoses, and we were seeing kind of an increased prescription rate of opioids, especially for injuries that typically in the past did not, the medical profession wouldn't have prescribed this range of medications. And for young people taking an opioid or being prescribed an opioid, often it was for a sports injury. It's very addictive, and it would prove to be very addictive in a younger population. True, addiction is a problem, obviously, for an older population, but later it was found, as we got more information about opioids, that the impact was particularly severe in young people. And so here in Juneau, this was in the late 90s, there were a number of athletes, sports athletes, who were injured and then subsequently were prescribed an opioid medication to deal with the pain. And we were finding that there was a very high rate of addiction, even in our local communities, in our smaller communities. So I think what happened was when opioids first came on the market, they may have not been fully understood, the addictive nature of this range of drugs. And unfortunately, I think it can be argued that there was an overprescription of opioids all across the country. We saw that. So here in Juneau, there was a woman by the name of Michelle Morgan. She was a nurse by training, but she started a group called Stop Heroin, Start Talking. And she was very successful. She went all over the region, talking to people, engaging with various stakeholders. And she was the one really that pushed a range of legislation that included the Narcan prescription bill, which allowed standards to be established for the dispensing of this opioid overdose drug. But there were other bills, too, that were passed. HB 369 passed in 2014, and that was also referred to as a Good Samaritan bill. Another way it's been referred to in other states is, quote, don't run, call 911. And this was passed because there were cases where individuals that were unfortunately in a situation where a person was OD experiencing an overdose would feel that they may be prosecuted, right, for a crime. And sometimes there was a specific case actually in Alaska where an individual was overdosing and her friends left the scene and that individual passed away. HB 369 addressed this problem and created immunity for individuals that reported a drug overdose, immunity from prosecution. So again, you had HB 369, you had SB 73, the Narcan dispensing drug, and then There was also the implementation of drug database where prescription medication would be required to register with the state of Alaska. And this was to address a trend where individuals might shop around. They might go to one doctor and get a prescription and then go to another and get a prescription. That type of activity would be identified in this database. So those were some of the three big issues that I worked on as a legislator as it relates to this topic.
Yeah, that's amazing. I just know how effective it's been because just looking at Project Hope, I was just looking at their website here a little while ago, and they distribute all the Narcan kits all over the state. And I counted there's probably 120 different sites that they distribute Narcan kits to. Wow. And that's an amazing number, JT. I mean, you think about it, that's a lot of Narcan kits going out. And
wow.
It's saving a lot of lives. And you guys saved a lot of lives when you did this. And it's such an important thing. And we were speaking with Chief Ed Mercer in our last podcast about the police department carrying Narcan kits and how they saved a life. Just recently during our podcast, Ed commented about how one of his officers had revived somebody just in the last few days. And
wow.
Yeah, it's so important to get this out and get this word out.
Well, I remember when this opioid crisis, we're still in an opioid crisis, but we have a much greater awareness and we have tools now to effectively deal with opioids. But back in the 1990s, up until the early 2000s, my daughter graduated from school in 2010. There was a time when I believe it was the basketball team here in Juneau, and many of the players were actually on opioids. And it was very prevalent. And now, of course, our awareness is much greater. I don't think it's as prevalent, at least in younger populations, as it was at that time.
Yeah, one of the really critical problems we have now is that beyond opioid is that we've gone into this whole new fentanyl situation, which is anywhere from 50 to 100 times worse than opioids. And it's coming in counterfeit pills and making it very impossible to detect, and people are overdosing from it way more frequently than the opioids in the past. And beyond that, there's another drug that's just hit the scene here on the East Coast called isonitazine, and it's supposed to be 50 to 100 times greater, stronger than fentanyl. So we're really facing a huge crisis here coming up now. And it's hard to determine how we're going to deal with all this. But I know there's programs. Have you guys in the Labor Department had programs to help people with drug abuse situations?
Well, at different times, we've had grant opportunities available through the department to educational providers. And then we also work very closely with training. We have a number of training sources of revenue, both state and federal. So our focus is really to work with at-risk populations. We have an initiative right now at the At-Risk Youth Initiative that really targets young people that are homeless or that are in shelters. We have a partnership with the Covey Academy in Anchorage, the Covenant House. Our goal is to get young people trained and get them connected to resources that will help pay for that training.
How do they get to that point? How is it that they can get into these programs?
So in terms of how do we make contact, we have partnerships with organizations that work with at-risk youth, such as Covenant House in Anchorage, an organization called My House out in the Mat-Su Valley. We work with alternative high schools around the state. We actually go into the schools. We go out to the centers, like I said, the Covenant House and My House, and meet individually with young people.
That's great. So you have a kind of an outreach program in that sense then.
Mm-hmm.
Yeah.
We also will, through our federal source of funding called the Workforce Innovation and Opportunity Act, we partner with organizations like the Southeast Regional Resource Center here in Juneau to provide funding specific for training for youth ages 16, I believe it's 16 to 23. And there's a number of different great opportunities, training, everything from IT to culinary to diesel mechanics to aviation. We do a lot of great work around the state. It's pretty exciting.
Yeah, that's great. And, that will have an impact on drug abuse too. If you get people working and
That's
happy
right.
and, having a good life, they're not going to
Yeah.
use drugs as much, So that's a really positive thing.
Yeah, a job solves a lot of problems, doesn't it, Tech?
It does. I mean, it's so important. We really emphasize it. I try to employ as many people as I can out here in our little town.
I know you do.
And it is important. So let's switch gears for a minute here and let's talk a little bit about drug testing. And you and I had a little conversation before about drug testing in the seafood industry. And you hit upon a kind of an interesting fact in that drug testing has decreased since the pandemic has ended. And you gave a couple.
I have some statistics here. In 2019, seafood processors, these are on-land processors, tested 44% had a drug testing program. In 2020, that dropped to 32%. 2021 dropped to 16%. And in 2022, it's down to 8%. And I think a lot of that may have to do with the challenges of employment, attracting individuals into the sector. But I can't say for certain, but that is the data that I have on that issue.
Yeah, and it's kind of interesting with the drop in those statistics. And you're right, I'm sure it is. Just trying to get people to come to work right now is a very difficult situation. But
yeah, there are more job openings now in Alaska than at any time in our history, believe it or not. So it's a great time of opportunity for people of all ages, young people and people that are middle in their career. There's a lot of demand right now for employment.
Absolutely.
For workers.
Yeah. But in terms of drug testing, it's really important. And one of the things that we see statistically in the seafood industry is that it has the highest rate of accidents out of any industries. When we think about that, we have some pretty high accident prone industries when you think about mining and working in the oil fields, but fishing is the highest by double. And that's a pretty high statistic. And it would seem to me like it would behoove the seafood companies to get more testing going again, because that would lessen the amount of accidents. And of course, that always changes your insurance rates too. So it would.
Yeah. And I can't tell, specifically the correlation between testing and accidents, but I can imagine that there must be a correlation, right? I do know that in the seafood industry, that through our workers' compensation division, which tracks accident data, there were 836 incidences of injury in the seafood industry that were reported to workers' compensation. That was for, potentially to get coverage for that injury or, for the injury. And then the fish fund, if you're a commercial fisherman or a deckhand on a permitted vessel, the fish fund had 194 claims for payment. Because in Alaska, fishermen actually don't pay workers' compensation. They don't have workers' compensation coverage, but a portion of their permit fee goes to the fish fund, which helps cover the costs of an injury in the event of an injury while working.
Yeah, that's really important. People need to, especially fishermen, we're all independent people. And having been in the fishing industry for over 50 years myself, there are a lot of drugs in the fishing industry. It's unfortunate, and we tend to be very independent people, and there tend to be a lot of drugs around and drug usage. I know in the 80s, especially up in the crab fishery, there was a lot of amphetamine and cocaine use. It was kind of rampant up there. That's changed though, but it has changed to the opioids, and I know that Project Hope's been sending a lot of Narcan kits to the processors.
Good.
Yeah. Well, okay. Thanks, Kathy. We just want to thank you for being with us today. Is there anything that you'd like to add on?
Well, I did want to also mention that the state of Alaska, we operate the Occupational Safety and Health Program, We have a state plan. We're one of 26 states that operates its own plan. But in the case of the fishing industry, our federal partner, OSHA, actually oversees reports of injury and, death or fatalities or serious injury in the workplace. So in trying to get data together specific to injury, it's difficult for the state of Alaska directly through the Department of Labor, because the maritime industries really doesn't fall under the state plan, but it is under the federal plan.
Yeah, I guess that's part of the complication of all of this, is that there's so many interagencies that we cross.
Yeah, there's a lot of different players, that's for sure.
Yeah.
But I appreciate what you're doing, Tuck. You've always been a leader in trying to do the best in the community and doing good work. I'm really happy that you're taking a lead in this area as well.
Yeah, thank you, Kathy. And we're be excited to follow your new position here. I wish you the best of luck and keep it on up and keep working on these programs, especially drug abuse and helping people that in the workplace that have drug abuse problems.
Well, thank you. And if you would like, I could put you into contact with our at-risk youth team. They do great work around the state, and I'd be more than happy to have them share that information with you if you're interested.
Yeah, that'd be great. Could very well be another one of our podcasts, right, JT?
Yeah.
Okay. All right. Well,
awesome. Thank you so much.
Yeah, thank you, Kathy. You have a good night.
Take care. Okay. Thank you, JT.
Yeah.
Bye-bye.
Bye.